Bismillahirrahmanirrahim. Assalamu alaikum, respected audience. Today, my topic of discussion is about a very serious eye health condition, that is corneal meltdown, and how it happens due to corneal infections. Today, we'll see its different causes and possible treatments. This is a classical case of corneal meltdown. There is no cornea over there. This damage has been done because of infection. The corneal cells have undergone necrosis, thinning, damage, destruction, and we can see the inner eye contents, the lower iris brown pigments, iris over there, and eye is exposed to the external atmosphere. We usually put this green color is because of a dye which we put to see any leakage, and there in the eye it is total green. All around there is leakage happening over there because of this meltdown. If you talk about the conjunctiva, it is inflamed, red, congested, everything happening. So this is a very important case, and this is an emergency situation. As I have already mentioned in my previous videos, that whenever such patients come to us, our first target is to save the eyeball. And once the eyeball is saved, then we can think about vision restoration, vision rehabilitation. The reason is, up till now, the infection is involving the cornea and the outer structures. But now eye is open to atmosphere. There is no barrier. If that infection penetrate inside the eye, this patient will develop further infection in the eye, which we call endophthalmitis. The inner layers of the retina of the eyeball will be involved. And if not controlled, then the situation is called panophthalmitis, which is, we call it all the layers of the eyeball, including the soft tissues involvement, infection has gone up to there. So at this stage, we have to control and maintain the integrity of the eyeball. The first target is. Second reason is, if we do not secure this area, which has sloughed off, which has undergone melting, the inner contents that I'm talking about, retina, iris, all these things, will undergo structural damage. Reason is that inside the eye there is aqueous humor, the water, which maintains the pressure, and all contents remain at their place. But now there is no pressure. Normally it is 19-20 pressure of the eyeball, which we call intraocular pressure. But now there is no pressure. And the structures, as I mentioned earlier, will undergo the changes. So this is an emergency, the sloughing off of the cornea, and these patients should be immediately admitted. And what is the best solution when such big damage has been done over there in the cornea? That is the only one in such situations that we have to put a corneal graft over there to secure the area, to maintain the normal eye structure, at least to maintain a barrier to the inner structures from outside, so that microorganisms do not go inside. So let's have a look. What are the possible ways to do it? This is a case where a therapeutically corneal graft has been put over there. We call it keratoplasty. The old sloughed off infected cornea is removed, is cut and removed, and in that place we put a donor cornea over there. It has benefits, as I mentioned. It's number one, the infected cornea, which was full of infections, that is removed. Number two, immediately restoration of the eyeball. A barrier has been created once again, so that infection will not penetrate into the eye. Number three, the eye pressure will also be maintained. Inner eye contents, as I mentioned, will not undergo structural changes. So this is the way, the emergency, we can manage such situations. It is an emergency, and after this, the patients are put on antibiotic drops. The antibiotic drops are according to the culture and sensitivity report from the host tissues which was removed over there. And we usually go for, until the report is available, we can go for vancomycin, prepared fortified drops, or fortified ceftazidime eye drops. And intravenous antibiotics should also be administered in such situations. And once this structure has been secured, we can go for the vision rehabilitation. But the question is, what are the conditions which, if not properly managed, can lead to such advanced damage in the eye? This is our point today, that corneal sloughing off happening over there, and then going up to this extreme condition to secure with a graft keratoplasty. What are the conditions which can take us to there? So let's have a look at those. Contact lenses use and care not taking over there. Nowadays, we are prescribing contact lenses to our patients. It is used for medical purposes. These are used for the cosmetic purposes. And these are very safe, provided proper care is taken. Many times I have seen patients, they are just putting it and removing it without washing, cleaning their hands, and routine like this, as it is minor thing, just put the finger, take it out, and then pick it, putting the contact lens on the tissue paper, and then putting in the eye. No, it is wrong. The reason is that eye is a very sensitive structure, and there is a corneal epithelium over there, the outermost layer, which is protecting and preventing the entry of microorganisms inside the eye. Even a minute injury, fine damage over there, breaches and compromises that defense mechanism. Many times we see patients who do not take good care with their contact lenses. They come to us with infections. Contact lens infections, induced infections. And once that there is a breach over there, there is damage in endothelium. We know in the eyelids, there are all over the body, there are microorganisms. So when we talk about the eye, staph bacteria are over there. And if the situation goes wrong, then they can be very lethal. When we say for eye, that a pseudomonas can get entry. So my first point is to my respected audience who are using contact lenses for therapeutic, for their glasses, or for their vision, or even for the cosmetics, or for occasional use, to have extreme care and properly cleaning of their hands, and proper regular cleaning of their lenses. Keep an eye on the solution and the container where they are putting their lenses. Any redness, inflammation, light insensitivity, pain in the eye, they should immediately report to the physician. Usually they ignore it, they keep on managing themselves, and then once the infection is there, it keeps on aggravating. And many times we have seen patients that they get serious infections when they do not use proper protocol for the contact lenses. So this was the first point I wanted to make clear to my respected audience, that the people who are using contact lenses, they have to be very careful. Towards other conditions where corneal ulcers can develop, and then they can move to the advanced stages. This is an example which we call neurotrophic corneal ulcer. The name shows that whenever the nerve supply of the cornea, the outermost layer, the cornea is richly supplied by the nerves, and whenever these nerves are damaged over there, the nerve plexus, which is very important for the health of the corneal epithelium, whenever it is damaged, such neurotrophic corneal ulcers can develop. And it is quite challenging to manage, but manageable. Up till now in this we can see that there is just a corneal ulcer. The signs of infection are not there. The hypopyon, which we call the pus in the eye, has not yet developed. So neurotrophic ulcers, because of any chemical injury or because of medical illness in which the nerves are compromised, can develop. For example, diabetics. So this is a classical case of neurotrophic corneal ulcers. To another photographs. Here we can see in one that there is all around opacity, central white cornea. This is called abscess formation, corneal abscess with corneal ulcer over there. As we know, the abscess is accumulation of pus in the body, in any organ. It also happens in the eyeball, in the cornea, and this has involved more than, I can say, in this patient 75% of the eyeball, of the cornea. And there is we did not put the dye, but there is a central corneal ulcer. And if you see the lower portion of this, you will see whitening with the horizontal margin contour, that is hypopyon. The pus is being accumulated over there, and so this is one of the cases which I am showing you. And this patient, if I tell you history, because of the fungal infections. Fungal infections, this usually happens with wooden injuries, with vegetation, and these are also quite challenging to manage. While the other patient photograph is persistent epithelial defects. That happens when a patient develops chemical injury using cleaning acids or anything in washrooms or kitchens, and these chemicals just spill over there and go into the eyes. Then these types of things happen. The reason is the chemical, the acid, has damaged the limbal stem cells, and the limbal stem cells are the regenerating cells, that are mother cells, which are coming from the margin of the cornea and the conjunctiva, that white area. From there the limbal cells, when those are, the reservoir is damaged from the sides, so the healing process is hampered and affected. So the other one is persistent epithelial defects, also very challenging to manage. This is another photograph of one of the patients. Here you can see whitening, that is scarring has happened because of repeated episodes of infection, and in the center there is corneal ulcer. This is the case of viral attack on a patient. In these patients, virus keep on reactivating. They are treated, they settle down, they became inactive, and after, during favorable conditions, when any time in the year the immunity is suppressed or patient is sick, they get reactivated, powerful again, and they affect the corneas. So this is a case of which was managed, and herpetic infections, but there is central staining over there, and the scarring shows that repeated episodes. It was previously managed, it healed, and then it happened, and so scarring and whitening has happened. And in the center again there is a corneal small ulcer. So viral, for example, most commonly we see herpetic viruses. We know herpes simplex, herpes zoster, these viruses. Patients come to the medical emergencies for these infections, herpes zoster, chickenpox, and all these things. They have a potential to affect the eyes, and they stay over there, get treated, remain inactive, and then they, under favorable conditions, when the immunity is down, they get reactivated. So this is another case of the viral infection causing the corneal ulcer. One of the condition is, we know patient comes to our clinics and that is allergy, redness, itching, and watering in the eyes, mild cases. But in the allergies, sometimes we get advanced resistant patients, and that is this which I'm showing, that we atopic. The patients developed sometimes corneal ulcers, and the blood vessels all around this are an attempt from the eyeball to save the eye. The blood vessels growth is to control the inflammation over there. This is a defense mechanism from the eye to control the situation over there. And the green color dye which I did put over there, this is just to show the area of the stainings, to show the area of the damage over there. So these things, ulcers, can also happen in the advanced and resistant cases of allergies, which we call atopic keratoconjunctivitis. Reason, the same as I mentioned, the limbal cells, the mother cells which are present at the limbus, at the margin of the cornea and the conjunctiva, they move. Those mother cells are damaged in such situations, and once they undergo damage over there, the reservoir of these parent cells is decreased, and patients develop such types of ulcers. That was our today's presentation about advanced damage to the cornea when the cornea has undergone meltdown, sloughing off, and but before that there are many stages where we can prevent and control the situation. Either whether the patient is using contact lenses, or he has got viral, bacterial, fungal infections, trauma, or anything, he has developed infection, it can be controlled, it can be managed, provided proper medical advice is taken, proper antibiotics are started in time, and regular follow-up is done. Things are manageable. In conclusion, I can say that if the situation is given proper importance, but if carelessness is done from the management side or from the patient side, such serious consequences can also happen when we have to put a corneal graft to control it. And sometimes it is, the damage is so much damage that even we cannot put, because infection goes inside the eye and there is no visual potential, and it is spreading and all the eyeball and even the soft tissues around it, which we call the panophthalmitis. In that situations, many times we have seen patients when the eyeball has to be removed over there. So that was my today's presentation. I hope my today's presentation will be beneficial for my respected audience in their clinical practice and management. I want to thank you for your attendance and attention. Thank you.